I'm your host, Robin Berardini, live in studio with the one and only, the doctor is in, Dr. Walter Tom, Medical Director for the Aesthetic Laser and Vein Centers, Santa Rosa and Napa, their website, laserandvein.com, talking about kind of a fun part of the body today, the lips.
A lot of times patients will come in, and when they're talking about their lips, they look at it and they're focused on what we call the smoker's lines, and those are the vertical lip lines. And then as we get older, we know that we do lose volume. As those who have been kind enough to listen to our show on a weekly basis, we know that our faces are full as well as our lips, and then as we age, we begin to lose volume in those areas. Patients do come in and they are concerned about those vertical lip lines, and they're also concerned about the loss of volume. So not all lips are alike, and definitely it is person-specific. If we look at the celebrities, for instance, one of the first people that jump into people's minds is Angelina Jolie.
Absolutely.
Okay. And obviously she has large lips. What makes them proportional, if you like the way that Angelina Jolie looks, and those who listen always know I say that, is the lower lip should be larger than the upper lip.
Okay.
So the lower lip should be about 50% larger than the upper lip. And that's where we have patients coming in who want their upper lip to be bigger, or maybe the doctor or nurse who's injecting thinks the upper lip should be bigger. And they think they're giving them the pout, but in essence, what they're giving them is more of that fish look. Okay, oh, you found that. You pulled it up on the internet for us, Anne Margaret, and so you can, if you're not driving and if you're at home, you can pull up Anne Margaret and Angelina Jolie, and you'll see a photo of that and see how large her lips are. But you'll notice that her lower lips are larger. And the formula that I use is that your lower lip should be about 50% larger than your upper lip. So you can have full lips.
That's bigger than I thought.
Much bigger than you would realize, but that gives you a natural proportion for women with large lips or with thin lips. Also, what you are looking at is that it tapers, so it's not wide all the way from the middle to the ends. So it tapers very nicely. So when we inject fillers, and for those who are new to this cosmetic world, the fillers primarily that we use for the lips are called hyaluronic gels. They're a natural biological occurring gel in our bodies. We have it in our collagen. And of course, it's made in the labs by these various companies. Restylane is the most popular, along with Juvederm. We can use anesthesia, use a lot of ice cold packs. We can make it as comfortable as possible, but where I start off is I inject the lower lip in the middle third. So I'm trying to enhance that area to give that sense of vitality or sensuousness. And it doesn't matter. It's sort of, I joke even when I'm taking care of sometimes 70-year-old or older patients, and I'll say, let me just put a little bit in your lower lip if you're afraid of doing anything on your lips. And by just doing that, I'm going to give you a little bit of a sultry pout. And as soon as I say that, it cracks me up because they kind of look at me, and if they trust me, they kind of say, okay, let's do it. And I inject a little bit in there, and I show them the mirror right away, and they love it. They love that look. And it's just by enhancing that middle third of the lower lip. Now, we add a little bit as we move on the lower lip out towards the corner. Okay. Now, then what I do after I inject the lower lip with either Restylane or Juvederm is then we'll add some volume of the upper lip, and I'm watching it as I put incrementally a little bit at a time, so that again I try to keep that proportion of the lower lip being larger than the upper lip.
I guess what I'm hearing from that is you don't have to be afraid of this process.
Definitely. So we make it a relatively comfortable procedure. And most people love it because we're letting them not watch the procedure itself, but after we do a little bit, we let them look. And so they're kind of helping to manage their ultimate outcome of their look.
So in case you're nervous about it, I guess that's what comes to mind for me, is that you would just do a little, and then we can kind of see how we're feeling about it.
Definitely.
That's
definitely
amazing.
Our consultations are always free. They're complimentary.
Check out the website at laserandvein.com. We look forward to seeing you again next week on Newstalk 1350 and the new FM 103.5 KSRO.